Welcome, everyone. We are going to explore how food can be a powerful tool for supporting both diabetes and kidney health. Before we get started, I will quickly introduce myself. My name is Hanaa Azzouz. I am a registered dietitian with the College of Dietitians of Ontario. I completed my honors specialization in nutrition and dietetics at Western University. Followed by the DDEPT internship program. My clinical training was across London Health Sciences Centre and St. Joseph's. This clinical training included renal care, medicine, surgery, mental health, and diabetes. I was also diagnosed with lupus in 2022. It is an autoimmune condition that can affect kidneys and cause kidney failure. It does not impact my kidneys so far, but that personal experience really deepened my interest and passion for kidney health and supporting people living with chronic conditions. I'm very glad to be volunteering with the Kidney Foundation of Canada and to be presenting today. Just a quick reminder that this presentation is for educational purposes only. Everyone has different needs depending on their stage of kidney function, medications, diabetes goals, and overall health. First, we will look at the connection between diabetes and chronic kidney disease. Diabetes is a long-term condition where the body has trouble controlling the level of sugar or glucose in the blood. The body doesn't make enough insulin or cannot use the insulin properly, or both of them. Insulin is a hormone that acts like a key to help glucose move from the blood into the body cells for energy. When insulin doesn't work well, blood sugar stays high. This can damage blood vessels, nerves, the eyes, the heart, and the kidneys. We look at some diabetes stats in Canada. We find that almost 90 to 95% of diabetes cases are type 2 diabetes. Type 1 accounts for almost 5 to 10%. So diabetes is also the number one cause of kidney disease and kidney failure. 1 in 10 Canadian adults has some form of CKD. Nearly half of people with type 2 diabetes develop signs of kidney disease, and diabetes causes around 38% of all new kidney failure cases in Canada. CKD is the presence of kidney damage or a decreased level of kidney function for a period of 3 months or more. There are 5 stages of CKD based on the estimated glomerular filtration rate, or eGFR, and the kidney function. So next we are going to look at some lifestyle changes that can help you manage diabetes and slow the progression of CKD. First is physical activity. Always check with your doctor before making major changes to your routine. The general recommendation is 150 minutes per week of moderate to vigorous activity, which is about 30 minutes on most days. Moderate activity, this could be something like brisk walking, and vigorous activity could be running, jogging, or swimming. Adding 2 to 3 sessions per week for resistance training. These are things like free weights, bands, or body weight exercise. This can also be helpful. And being active can improve insulin sensitivity, lower blood pressure, and support better mood and sleep. Another important lifestyle factor is a smoking cessation if you are smoking. Smoking plus diabetes greatly increases the risk of heart disease and kidney decline. There are free programs across Canada to help you succeed in smoking cessation, which you can access by scanning the QR code on this slide. Managing stress and sleep is another lifestyle modification because ongoing stress and poor sleep increase stress hormones like cortisol, which can raise appetite and blood sugar. Using strategies like mindfulness, support system, or counseling can help you improve eating patterns and blood sugar control. Lastly, food as medicine approach. So Diabetes Canada recommends that everyone with diabetes meet with a registered dietitian for individualized nutrition, for nutrition counseling. Working with a dietitian can lower your A1C, which is your average blood sugar, over the last 2 to 3 months by about 1 to 2%, which is similar to adding a new diabetes medication. We talked about the recommendation of receiving individualized nutrition counseling. So how can you find a dietitian? In many areas, you can meet with a registered dietitian for free through some publicly funded programs. If your doctor refers you to an outpatient clinic, or if you are part of a family health team or community health center, a dietitian may already be part of your care. You can also check with your public health unit since they often offer free nutrition programs. If you are receiving home care, ask your case manager if a dietitian is included in your services. And if you live in a long-term care, a dietitian is already part of your care team. Another option is to connect with a dietitian through public health lines. In Ontario, for example, you can call 811. So no referrals are needed. It is completely free. They can answer general nutrition related questions regarding common chronic conditions. You can also ask to connect with a nurse through this service. Another way is to work with a private practice dietitian. There is also diabetes education centers. For example, in Ontario, they offer free diabetes care by certified diabetes educators, dietitians, and nurses. They have advanced training specifically in diabetes care. They go through extra education and a national certification exam. So they really understand the day-to-day challenges that come with living with diabetes. The rule is to help you learn how diabetes works in your body and how things like food, medications can affect your blood sugars. Dietitians educators help with meal planning, carb counting, label reading, grocery shopping, culture foods, and navigating food choices when life feels busy or overwhelming. The nurse educators help you understand medications like insulin and teach you how to use tools like the glucose meters, the continuous glucose monitors, and insulin pumps. They also support with the emotional side of diabetes, like problem solving, reducing stress, and so on. These centers may also offer group classes and usually can offer services and resources in different languages. So who is eligible for such services? If you're living with diabetes or at risk of diabetes, that could be pre-diabetes, having polycystic ovarian syndrome, gestational diabetes history, high A1C, family history, certain ethnicities like Indigenous, Blacks, and Hispanics. Some centers may require a referral from your primary doctor, but many accept self-referral as well. So usually people with type 1 diabetes or gestational diabetes are referred early to a diabetes education center, and some people with type 2 diabetes as well. But many people living with diabetes and even some healthcare providers are not fully aware that these programs exist. Because of that, people often miss out on a timely, tailored nutrition support that could help prevent complications. For kidney disease, the early stages, especially stage 1 and 2, don't always require major dietary changes, and it is still a critical time to build healthy habits and protect kidney function. In Ontario, most people with CKD don't meet with a renal dietitian until stage 4 or later, when kidney function is already more reduced. That means there's a big window of opportunity that is usually missed. So, what are the goals for managing diabetes and CKD? First is to protect kidney function. That can be done by keeping blood pressure in target, like less than 130/80 unless you're told otherwise, and to reduce the protein in the urine. That can be done through medications, nutrition, and lifestyle. Also keeping blood sugars steady, that's your A1C, which is often the target is to be less than 7% for many adults, but it can be higher or lower for you based on your age, risk of having low blood sugars, and what other conditions you are living with as well. And preventing low blood sugars, and that is extra important as the CKD progresses, as kidney cleared medications more slowly. So next we will look at some nutrients and how they relate to diabetes and CKD. We will start with two minerals, phosphorus and potassium. So what is phosphorus? It is a mineral found naturally in foods, and your body uses it for bones and teeth, energy production, muscle movement, nerve function, building cell membranes, and DNA. So healthy kidneys remove extra phosphorus, but in CKD, the body cannot get rid of it in the same way. When the body cannot get rid of phosphorus, it can build up in your body, which is called hyperphosphatemia. This can cause itching and skin discomfort, bone weakening and bone pain, calcification of blood vessels, which can increase your risk of heart disease and stroke, can also cause muscle cramps and joint pain, and can affect the parathyroid gland. Two types of phosphorus, one that is naturally found in foods and one that is added to foods. Natural phosphorus can be found in chicken, fish, beans, lentils, dairy, nuts, seeds, and whole grains. Absorption, which means like how much your body takes in of the phosphorus, it depends on the source of the phosphorus. So plant sources, only 20 to 40% are absorbed by your body because the phosphorus is bound to something called phytate in the plant. Animal food sources, around 40 to 60% is absorbed by the body. Phosphorus can be found in foods like processed foods, and the body absorbs around 90 to 100% of it. These foods are like deli meats, bacon, sausages, fast foods, frozen breaded chicken, shredded cheese, flavored coffees like French vanilla, creamers, baked goods, dark cola drinks, protein bars, and powders with phosphate salt. Now we will look at some tips to manage high phosphorus. So you can cook at home using fresh ingredients, limit high phosphorus food, like limiting the serving size or the frequency. So for example, limiting dairy to 2 servings per day. Each serving is 125 mils or half a cup of milk or pudding or ice cream, like any of these dairies. You can also swap high phosphate foods with lower options, like for example, swapping dark cola that has a lot of phosphate in it with ginger ale, for example, and limiting foods with phosphate additives. So the foods that we just mentioned in the previous slide. So phosphorus is not required by law to be listed on the nutrition labels. So to check if a food product has phosphorus, you need to look at the ingredient list. You are looking for words that contains phos. So something like phosphate, phosphoric acid, sodium phosphate, and so on. You want to always check food labels regularly as recipes may change over time. So some people with CKD needs phosphate binders. These are medications that attach to the phosphorus in food, so your body absorbs less of it. And this way it helps manage high phosphate in the blood. Some of them are calcium-based, like calcium carbonate or Tums, and some are non-calcium-based. So I want to spend a moment talking about phosphate binders because when phosphate levels are high, it's not always just about the food that you're eating. Sometimes the issue is actually how the binder is being taken. So when we see high phosphate, our first step is often to review your diet, what foods might be contributing, and whether we need to adjust quantity or frequency and maybe avoiding certain foods altogether. But in many cases, the binder is not being used in the right way, so the body cannot get the full benefits. So we always check few things like, are you able to take your binder consistently? Do you usually forget about taking them? Is the taste difficult? Especially like for people who are on fluid restrictions and they cannot drink extra water to wash it down. Are you taking it in the correct way? Because some binders must be chewed while others must be swallowed whole. This makes a big difference. And timing is very important as well. Binders work only when taken just before the first bite or the first few bites of your meal. If you take it too late, it won't bind to the phosphate. It can actually just increase your calcium level instead. If you're having trouble with the dosing or swallowing the medication or the taste or the timing, just please talk to your healthcare team. Addressing the binder issues early can help you avoid unnecessary food restrictions, and it can really improve your quality of life. And since we are heading into the holiday season, remember you can also ask your doctor whether taking an extra binder or splitting your dose for larger or more protein-heavy meals is appropriate for you. Next, we will look at the potassium, which is a mineral that supports heart rhythm, keeps muscles and nerves working, helps manage blood pressure. When kidney function declines, potassium can build up in the blood, which is called hyperkalemia. High potassium can cause muscle weakness, tingling, irregular heartbeat, heart rhythm problems. In diabetes, high blood sugars or certain medications like ACE inhibitors, certain diuretics like spironolactone can also increase potassium levels in the blood. So restricting potassium from food depends on your lab results. Potassium is listed on the nutrition label, and you can also find potassium additives in the ingredient list, just the same as the phosphorus. So you're looking for words that contains potassium, things like potassium chloride, potassium phosphate, and so on. Again, you wanna check the food labels and ingredients regularly as the recipes may change over time. Now we will look at some tips to reduce potassium in food through food preparation and cooking. So for some preparation tips, peel and cut vegetables into small pieces to make it easier to remove the potassium. Soak root vegetables for 2 to 4 hours, then drain. Soak dried legumes for at least 12 hours. Rinse canned foods well under running water. This can remove 30 to 70% of the potassium and the salt in the canned food. Choose lower potassium options when possible. For example, blueberry instead of bananas. So cooking methods is also important to reduce potassium. For potassium-rich foods such as potatoes and beans, these slow cooking methods like smearing for a long time or roasting tend to trap the potassium inside the food and sometimes even concentrate the potassium in each serving. So what can we do instead? We can use a method called leaching or the double cook method. This helps remove a good amount of potassium. So peel and cut the vegetable into small pieces. As mentioned before, boil them in a large pot of water, drain the water, then boil them again in fresh water and drain again. Make sure not to use the cooking water for soups or sauces because that water now contains the potassium we are trying to reduce. After leaching, you can prepare the food however you enjoy, for example, baking potatoes. Potassium can also be supported by watching portion sizes and how often you eat certain foods. Not necessarily by cutting them out completely. For example, high potassium foods like tomatoes or oranges can still fit. Try a portion size of half a medium tomato or orange and limit them to once per day. Medium potassium foods maybe aim for 1 or 2 portions per day, and for low potassium foods, these are more flexible and can be included more often. Spreading your fruits and vegetable throughout the day can also help prevent potassium spikes. Next, we will move into protein and why it is important when living with both diabetes and CKD. Protein plays several key roles in the body. It supports muscle and strength, which helps with mobility and daily activities. It's essential for immunity and healing. It helps prevent frailty and fatigue. It is needed for hormone and enzyme production, and in diabetes management, protein helps slow the digestion of carbohydrates, which can reduce blood sugar spikes after meals. It also helps you feel full longer, which may reduce cravings later in the day. So your muscles act like sponge for blood sugar. Almost 3/4 of the glucose in your body is stored in your muscles. So the more muscles you have, the better your body can pull sugar out of the bloodstream, and the less insulin resistance you would have. Both diabetes and CKD can speed up muscle loss, and when muscle goes down, it becomes harder to manage both conditions. So protecting your muscle protects your health and your independence as well. So the $1 million question, how much protein do you actually need? For comparison, the general population needs about 0.8 grams of protein per kilogram of body weight per day. And that's really a minimum requirement, not necessarily for optimum health. For people living with diabetes and CKD who are not on dialysis, the recommended range varies between different guidelines. It's usually somewhere between 0.6 to 1 grams per kilogram, with around 0.8 grams being the most common target. These recommendations are based on ideal body weight, which may be different from your current weight. Something we often see is that people start eating less protein on their own when kidney function goes down. And sometimes that happens because of taste changes or feeling unwell. For those on dialysis, protein needs actually goes up because the dialysis process itself removes some protein from the blood. So the focus shifts to making sure you're getting enough. So here's an example of how to calculate protein needs. If the ideal body weight is 100 kilogram, we multiply it by 0.8 grams of protein. In this case, we get 80 grams of protein per day. So to convert from pounds to kilogram, you just need to divide by 2.2. So if the ideal body weight, for example, is 160 pounds, just divide it by 2.2, you're going to get the weight in kilograms. In this case, it's around 73 kilograms. And then multiply it by 0.8 to get the amount of protein needed per day. It's very important not to confuse the amount of food with the amount of protein in it. So what does that mean? So if we have, for example, 3 ounces of cooked meat, which is around 90 grams, that would contain about 25 grams of protein. So why do we care about limiting protein in CKD? Protein breakdown creates waste products such as urea and creatinine. Healthy kidneys are able to filter these out, but in CKD, this becomes harder. Too much protein can lead to more kidney workload, and it can also increase pressure inside the kidneys. So is there a difference between plant and animal protein when it comes to CKD? Plant protein can be found in things like beans, lentils, tofu, nuts, seeds, and whole grains. They produce less acid in the body, which may help reduce kidney stress. A common worry is that plant proteins aren't complete. In reality, All plant foods have all essential amino acids, just in different amounts. We used to think you have to combine foods like beans and rice in the same meal to get all the essential amino acids. But the newer evidence shows that simply eating a variety of proteins across the day gives your body everything it needs. Animal proteins like meat, fish, eggs, and dairy are easier to use by the body. They are high in leucine amino acid, which helps with muscle repair and strength. However, animal proteins create more acid during digestion, which can add some extra workload on the kidneys. They also tend to contain more highly absorbable phosphorus, as we mentioned before, which can raise blood phosphate levels for those with CKD. So what is recommended in terms of what type of proteins? So a mix of plant and animal proteins work very well for many people. Gradually including more plant proteins in your diet may benefit your kidney health, and paying special attention to processed meat by avoiding them as they are harder on the kidneys. When we talk about fats, it's not just about calories. The type of fat you eat really matters, especially if you have diabetes and kidney disease. Fats influence several key areas, like how steady your blood sugar stay, your cholesterol and blood pressure, inflammation in the body, heart disease risk, which is already much higher in CKD and diabetes, and even long-term kidney health. The guidelines message is to choose more healthy and saturated fats, things like olive or canola oil, and nuts, seeds, and omega-3 rich fatty fish such as salmon. These help protect your heart and can support better blood glucose control. And also you can choose fewer saturated fats. These are things like butter, the visible fat in meat, coconut oil, and palm oil. These tend to raise the LDL or your bad cholesterol and inflammation, which can add strain on both the heart and the kidneys. If you don't have fluid restrictions, remember that fluids come from many sources like just water, tea, coffee, soups. Your needs of hydration depends on your age, your activity levels, your medications, and the weather. With diabetes, high blood sugar causes more urination and thirst. As the blood sugar level improves, the excessive thirst usually settles, and you can focus on drinking enough to stay hydrated. Usually there is no fluid restrictions for the earlier stages of CKD, but some people might need fluid restrictions for one reason or another. So if you have a fluid restriction, it is important to follow it closely to prevent swelling and fluid buildup. So these are some tips to manage thirst if you have fluid restriction. So maintaining good blood sugar control and limiting salt intake will decrease the thirst. Choosing smaller cup sizes and sucking on sugar-free hard candies, freezing some of your fluid allowance as ice cubes as it stays longer in your mouth, sipping fluids slowly, like using a straw, for example, rinsing your mouth with a mouthwash or a brush, or brushing your teeth, and staying cool. Also, taking medications with soft food like applesauce, for example, instead of fluid when possible. Now, let's talk about fiber and why different types matter for diabetes and kidney health. There are two main types of fiber, plus something called resistant starch. It acts like fiber. So there is soluble fiber, which is found in foods like oats, beans, and some fruits and vegetables. This type forms a gel in the stomach, which slows the digestion. It helps steady blood sugar and can even help lowering cholesterol. And there is insoluble fiber. They can be found in wheat bran, whole grains, and many vegetables. They add bulk to the stool and helps keep bowel movements regular. This is especially important in CKD because when stool stays longer in the colon, more potassium gets absorbed, which can raise potassium levels. So regular bowel movements really help with potassium control, um, especially if you have like potassium restriction. Then we have resistant starch, which isn't technically a fiber, but it behaves like it. You can find it in green bananas, some whole grains, and in foods like potatoes or rice after they have been cooked and cooled. It resists digestion, feeds healthy gut bacteria, and is linked to better insulin sensitivity, meaning better blood sugar control. As for how much fiber we need, the recommendation for the general population is about 25 to 38 grams per day. But most Canadians only get around 14 to 19 grams, which is much lower. There are no specific fiber amounts guideline for CKD. When it comes to fiber, increasing it slowly is really important. If you add too much too quickly, you may notice bloating, cramps, diarrhea, or even constipation. So take it step by step. Staying hydrated also matters. Fiber needs fluid to move through the gut. So without enough water, constipation can actually get worse. If you have a fluid restriction, follow the plan your care team has set for you. For people with CKD, getting enough fiber can be tricky because many high fiber foods are also high in potassium or phosphorus. A simple option that works for many is adding 1 to 2 tablespoons of ground flax or chia seed uh, per day. They are lower in potassium and phosphorus and easy to sprinkle on meals. Some people may also need fiber supplements or medications to help prevent constipation, especially if potassium levels are high or bowel movements are not regular. And one more interesting point, some research suggests that eating fiber first, then protein or fat, and leaving carbohydrates for last may help reduce blood sugar spikes after meals. We will talk about carbohydrates. Carbohydrates are the body's main source of energy. We find them in foods like grains such as rice, pasta, bread, quinoa, as well as potatoes and other starchy vegetables. They are also in fruits, milk, and yogurt, beans and lentils, and of course in snacks and desserts. For people with diabetes, carbs matter because they directly affect blood sugar. Knowing how much and what type of carbs you are eating helps keep blood sugars steadier throughout the day. And in chronic kidney disease, steady blood sugars are especially important because they help protect kidney function over time. I also want to address something I hear all the time, the fear of carbohydrates. Many people feel pressure to cut carbs very low, but the research shows that completely avoiding carbs is not necessary and not recommended for most people with diabetes or CKD. The guidelines emphasize balanced meals and portion awareness. Carbs don't just provide energy, they also provide fiber, vitamins, and minerals, and they can be absolutely a part of a kidney-friendly diabetes diet. So instead of being afraid of carbs, we focus on how to choose them and how to portion them in a way that supports both your blood sugar and your kidneys. So some practical tips for diabetes from Diabetes Canada is to aim for 3 meals per day at regular times. This helps keep your blood sugar steady and prevents big swings. Try not to go more than 6 hours between meals. Going too long without eating can lead to low blood sugar for some people and then higher spikes later when you finally eat. Adding healthy snacks if you feel hungry between meals. Limiting sugars and sweets and high-fat foods. Choosing high-fiber carbohydrates. And if you're thirsty, drink water instead of sugary drinks. Limit alcohol consumption as it can affect your blood sugar levels and it can cause weight gain. This one here is it's an easy way to estimate portions and plan your meals without measuring cups or scales, just using your hands. So for example, for grains and starches or fruits, aim for about the size of your fist. This helps manage the carbohydrates so blood sugars stay steadier. For vegetables, you can enjoy 2 handfuls of non-starchy vegetables, which are lower in carbs, and they are great for blood sugar control and provide fibers. For meat or alternatives, your portion is about the size of your palm and as thick as your little finger. For fats, keep it to an amount about the size of your thumb tip. Another simple way to build balanced meals without counting, measuring, or doing math is the plate method. It helps you spread your carbohydrates evenly through the day, which keeps your blood sugars more steady and also makes things easier on the kidney. Here, how it works. So half your plate is vegetable that are low in carbohydrates and high in fiber. So those are the non-starchy vegetables. A quarter of your plate is grains or starchy vegetables. This includes things like rice, pasta, potatoes, corn, or bread. The last quarter is your protein. And off to the side, you can also add small serving of fruits, which fit nicely into your carbohydrates allowance for the meal. And for a list of foods from different food groups and their portion sizes for people living with diabetes and kidney disease, especially when restrictions are needed, you can use this resource if it applies to you based on your lab results and your healthcare provider's advice. More advanced carbohydrate educations like insulin to carbohydrate ratios is highly personalized and it can change over time. So for safety and for accuracy, they should be taught and adjusted by your doctor or a certified diabetes educator. Now let's talk about hypoglycemia or low blood sugar. Low blood sugar usually means level below 4 millimoles per liter, or sometimes it could be higher for someone who routinely have high blood sugar levels. So some common causes include skipping or delaying meals, recent weight loss, drinking alcohol without food, changes in kidney or heart function, too much insulin or diabetes medication, more physical activity than usual. So these are the key things to watch for to help prevent the lows. When blood sugar drops, your body gives early warning signs. You might notice shaking, sweating, or fast heartbeat. Some people feel suddenly very hungry or a bit nauseous. If the sugar keeps dropping, symptoms can become more serious. Things like weakness, confusion, dizziness, or blurry vision. You may even have trouble speaking or focusing. These are all signals that your body needs sugar right away. When you feel low, the first step, if you can, is to check your blood sugar. But if checking isn't possible, treat it right away. We use the rule of 15. Take 15 grams of fast sugar, such as glucose tablets or a suitable juice, like apple juice if you need to limit your potassium. Avoid dark colas if you have phosphorus restriction. Then wait 15 minutes and recheck. If your blood sugar is still below 4 or you're still feeling low, repeat the 15 grams again. If your next meal is more than an hour away, add a small snack with carbs and protein. So something like crackers and cheese or yogurt and fruit, so your blood sugar doesn't drop again. If you are on fluid restriction, avoid liquid sugars and use glucose tablets or candies instead. And remember, sugar substitutes will not raise blood sugar, so they cannot be used to treat a low blood sugar. So there is no one diet that is recommended for managing diabetes for everyone. There are some diets that have been shown to help with managing blood sugar, for example, DASH diet and Mediterranean diet. So we're going to start with the DASH diet, and it stands for Dietary Approaches to Stop Hypertension. So it is a diet that was designed originally to lower blood pressure, but over the years, the research shows that following a DASH style eating can improve cholesterol and heart health. It can reduce risk of type 2 diabetes and some cancers. This diet is rich in potassium, magnesium, calcium, fiber, and antioxidant. So you can see this diet might need some modifications when diet restrictions are needed for CKD. So the DASH diet focuses on fruits and vegetable. So these are the basis of each meal, and also on whole grains as oats, brown rice, plant protein like legumes, tofu, seeds and nuts, lean animal protein such as fish, skinless poultry, and meat with the visible fat trimmed out. Low-fat dairy products such as skim or 1% milk, low-fat yogurt and cheese. It also recommends cutting back on foods high in saturated fats such as butter, processed meat, and avoiding deep frying methods of cooking. Also cutting back on added sugar, things like sweetened beverages and desserts. And finally, limiting salt, which we will talk about in more details later on. So here is an example of what the DASH diet might look like for someone eating around 2,000 calories per day. So the DASH diet includes a certain number of servings per day or week for each food group. So for example, for vegetables and fruits, each range from 4 to 5 servings per day. It also gives examples of what a serving size looks like. For instance, 1 cup of raw leafy vegetables would be 1 serving, while cooked vegetables would be half a cup. For grains, they can range between 7 to 8 servings per day, and for low-fat dairy, the servings are 2 to 3 per day. And if you look at the lean meats and poultry and fish, the recommendation is up to 2 servings or fewer per day. For nuts, seeds, and legumes, the aim is 4 to 5 servings per week. And for fats and oils, the goal is 2 to 3 servings per day. And for sweets and added sugars, they'll try to limit them to 5 or fewer servings per week. So here are some practical tips for the DASH diet. So instead of focusing on what you cannot eat, think about what you can add or what you can swap to make your meals a little healthier. So for example, if you normally have processed meat like deli meat or sausage, you might try swapping in a lean meat like chicken or turkey, or even a plant-based option like beans, lentils, or tofu. So these simple swaps can support your diabetes and kidney health without feeling like a big change. Same way when you go to the grocery store, it is way much easier to have a list of foods that you can actually get versus if you have a list of food to avoid. And shopping feels a lot less stressful and much more empowering. We talked before about adding fiber gradually while maintaining hydration. Also, prep ahead when you can. Use pre-cut or frozen fruits and vegetables. They are just as nutritious and they save time. Batch cook meals or ingredients for the week if you have space in your freezer. And keep easy foods on hand for busy or tired days. Things like canned beans, whole grains, eggs, yogurt, or frozen vegetables. When we talk about salt, what we really mean is sodium, the mineral in salt that affects blood pressure. For the general population, the chronic disease risk reduction recommendation for sodium is 2,300 milligrams per day. For the DASH diet, it recommends 1,500 to 2,300 milligrams of sodium per day. This equals roughly 3/4 to 1 teaspoon of salt in total. Too much sodium makes the body hold on to extra fluid, which increases blood pressure and puts extra strain on the heart and kidneys. Remember, a low salt diet does not mean no salt. It's about finding that right balance and flavoring food in other ways. So where do we find sodium in food? Only about 12% of the sodium we eat occurs naturally in foods. Around 5% is added during cooking and another 6% is added at the table. Nearly 77% of the sodium in our diet comes from processed or restaurant food. Some of the most common sources include things like bread and baked goods. They might not taste very salty, but we eat them so often through the day that keeps adding up. Other big contributors are processed meats, like deli slices, bacon, and hot dogs, along with soups, ready-made made meals, sauces, and condiments. Even snacks like salted nuts or cheese, especially processed types, can add extra sodium. So this gives us an idea of where we can make the biggest differences by focusing on where sodium tends to sneak in. Reading the nutrition labels, the first thing you want to check is the serving size at the top. All the amounts on the label are based on that serving size. So if you eat double that serving size, you are getting double the amount of sodium. So next, you want to look at the daily value percent. This number tells you how much of your daily sodium limit the food provides. So the rule of thumb is 5% of the daily value or less means the food is low in sodium. 15% of the daily value or more means it's high in sodium. For frozen meals, you might want to aim for like 600 milligram per meal or 10% of the daily value, as it is hard to find something that like a full meal that contains less than this amount. Finally, you want to look for the sodium on the label. That is the key nutrient we want to monitor. Here you can see this for this example, it has 30 milligrams of sodium, which is around 45% of the daily value. So this is quite high for just 1 tablespoon. You can see how quickly sodium can add up if we are not checking the labels. Now we will compare the same product with a similar one. So both of these products have the same serving size, which is 1 tablespoon, but a big difference in the sodium. So the label on the left has 160 milligrams of sodium, which is about 7% of the daily value. So it is considered a moderate amount, and the label on the right as we mentioned before, it has like 30 milligrams of sodium or 45% of the daily value, which is very high. And that's just 1 tablespoon. And on this slide, it shows some common sodium statements you might see on the food packages. So, for example, you might see something like sodium-free or salt-free. This means it has less than 5 milligrams per serving. And you see like other examples for other statements. You don't have to memorize any of these. You might just use them as a quick guide when comparing products and then double check with the nutrition labels. There's also the new Health Canada front of package symbol with the magnifying glass. You can again use it to quickly identify products high in sodium, but always check the nutrition label for the percentage and the amount of sodium. So now we can look at some tips on how to cut back on sodium at different situations. So for example, at the grocery store, try to choose fresh or frozen fruits and vegetables instead of processed ones whenever possible. Also, reading nutrition labels, as we just mentioned, is a big factor as well. At home, cook with herbs, spices to add flavors instead of salt, and limit pre-packaged sauces, broths, and mixes as they usually contain a big amount of sodium. If you are using canned vegetables or beans that are like low in sodium or with no salt added, you can drain them and rinse them to reduce the amount of sodium even more. For something like canned low-sodium chicken noodle soup, for example, what you can do is you can strain it and rinse it, then add it to a homemade broth or boiling water and season it with herbs and spices to enhance the flavor pack. When dining out, most chain restaurants now, the list nutrition information online, so maybe check them ahead for lower sodium options. You can also ask for your meal to be prepared without added salt if possible, or request sauces and dressings to be on the side, or choose smaller portion sizes. Finally, at the table, try to remove the salt shaker and taste your food first before adding salt if you have to. Maybe add your favorite salt-free seasoning instead of the salt. If you still feel like you need to add salt, avoid sprinkling it directly on your food. Maybe place a small amount in your hand first. This helps you see how much you're using. So for salt alternatives, you can make your own seasoning blends using your favorite herbs and spices. Adding citrus or vinegar can also enhance flavor without the need to add salt. Over time, your taste buds actually adjust to lower salt levels, and you will start to notice that food tastes naturally better. Also, keep in mind that seasoning blends like garlic salt or onion salt still contain sodium. So, choosing garlic powder or onion powder instead, and read the label or the ingredient list to make sure there is no salt. There are also convenient to store both seasoning blends such as Mrs. Dash or Clubhouse salt-free. And then we have something called salt substitutes. These products replace some or all of the sodium with potassium, which has a similar salty taste. You may see brands like No Salt or Windsor Salt Free. So it is always best to check with your doctor or dietitian before using them, as these salt substitutes may not be suitable for everyone. So the other diet that we will look at is the Mediterranean diet. It is based on the traditional eating patterns of countries bordering the Mediterranean Sea, like Greece, Italy, and Spain. The Mediterranean way of eating has been shown to lower the risk of developing heart disease, stroke, type 2 diabetes, and even some kind of cancers. It can also improve blood sugar, blood pressure, and cholesterol levels. And some research shows it can also support brain health and delay development of cognitive disorders. This pyramid can help us visualize how the Mediterranean diet works in daily life. At the base are fruits, vegetables, whole grains, beans, nuts, seeds, herbs, and spices. These are the foundation of each meal. Olive oil is usually the main source of fat, replacing butter or margarine. Fish and seafood should be eaten often, at least like 2 times per week. Poultry, eggs, cheese, and yogurt can be included in moderation, while red meats and sweets are eaten only occasionally. And water is the main beverage. So you can notice some similarities between the Mediterranean diet and the DASH diet that we just talked about. And the Mediterranean diet is not just about what you eat, it's also about how you live. People in the Mediterranean regions tend to make time to cook and prepare meals and share them with family and friends. This can support mindful eating and social connection. They also stay physically active and prioritize good sleep, both of which play a big role in the overall health. Wine is sometimes included in moderation with meal. Um, Always check with your doctor about whether alcohol is safe for you, and if so, how much and how often. And here are some recipe resources. So, depending on your stage, you might need recipes that are more tailored to your diabetes or might need more kidney friendly recipes. So, you have Diabetes Canada, Kidney Community Kitchen, My Spicy Tub, and Davita. We will be moving into the last section of this presentation where we will talk about weight management and GLP-1 medications in the context of diabetes and kidney disease. I want to acknowledge that the conversation about weight can bring up a lot of emotions and may feel uncomfortable or triggering for some people. If you prefer not to continue with this part, that is completely okay. Thank you so much for being here and for listening so far. If you feel ready and would like to learn more, you're welcome to stay as we go through it together. Talk about obesity, I want to start by saying this. This is a medical condition and not a personal failure. Obesity is now recognized as a chronic relapsing condition. What does that mean? It means it is influenced by how our bodies regulate appetite, metabolism, hormones, and even how our brain responds to food. It is not about willpower. Many factors like genetic, medication, stress, sleep, trauma, and access to food can all shape someone's weight. These are things we don't choose. It is also important to remember that people can live in a larger body and still work towards improving their health. Weight is only one piece of the picture. It is not the whole story. Our focus is always on health, function, and well being, and not on a number on a scale. So, why weight can matter for diabetes and chronic kidney disease? Research shows that even a small change in weight, around 5 to 10%, can make meaningful differences. We can often see improvement in blood sugar, insulin sensitivity, blood pressure, and even things like inflammation, sleep apnea, and joint discomfort. So these benefits are about feeling better and staying healthier. Another important point is the weight itself can affect kidneys, independent of diabetes. Carrying extra weight can increase the kidney's workload, which can contribute to albuminuria, which is protein in the urine, and a faster drop in the kidney function over time. So that's more decline in the um, EGFR. So there are many ways to support health and manage weight, such as balanced eating patterns, regular movement and activity. There are some surgical options and there are medications as well, like the GLP-1 medications. And health journeys are personal. Weight is, as we said, it's only one part of this picture. And there's no single approach that works for everyone. So you deserve a care that focuses on your goals and your values, your culture, and your lived experience. So let's talk about the GLP-1 medications. You might know them as something like Ozempic or Wegovy, among other names. These medications work by mimicking a natural gut hormone that your body releases after you eat. It's called the GLP-1. What do they actually help with? So they can lower your A1C by about 1 to 1.5%, which is similar to adding another diabetes medication. They often lead to weight loss, usually around 10 to 20% of your body weight, depending on the dose and the consistency. Newer research also shows that in people with diabetes or at high risk, GLP-1s can slow down kidney function decline. And in some cases, even increase EGFR slightly. And this is a big deal for kidney protection. And here's how they work inside your body. So they can increase insulin release, but only when your blood sugar is high. They can also lower how much sugar your liver releases, which helps keep the levels more steadier. They slow stomach emptying, which means the food stays in your stomach a bit longer. This helps you feel full sooner and stay full longer. And finally, they can also help regulate your appetite, which makes it easier to manage cravings and reduce overeating. So now let's talk about some of these side effects because knowing what to expect can make these medication much easier to manage. The most common side effects are things like nausea, vomiting, bloating, abdominal discomfort, or sometimes diarrhea or constipation. These reactions happen because the medication slows down how quickly your stomach empties. These are usually dose dependent. What does that mean? It means they are more likely to happen when the dose increases, and they are usually improved over time if we do the increase gradually. We also want to keep an eye on nutrition because these medications can reduce your appetite so much that you might not be getting enough calories, protein, B12, iron, or fiber, depending on what you are eating. So if you're eating much less or you're feeling full quickly, that's something to bring up with your healthcare team. Also, research shows that people can lose about 10% of their muscle mass over 68 to 72 weeks on these medications. If they aren't eating enough protein or doing resistance exercises, to put this into perspective, that is like losing 20 years worth of age-related muscle loss in just over a year, according to some estimates. So this doesn't mean that medication is bad. It just means that we need to be intentional about our protein intake and strength-based movement while we are on it. There are also some rare but serious side effects we can keep an eye on, such as gallbladder issues, pancreatitis, which is inflammation in the pancreas, possible thyroid tumor risk. Those are in some people with certain genetic condition, and usually, like if that's the case, like the medication would be contraindicated. That means it wouldn't be prescribed in the first place. And sometimes it can cause bowel obstruction, which is very rare. These are very uncommon, as we mentioned, but it's important to know the signs and check in with your healthcare team if something feels off. So again, it's always to remember the goal is not just that number on scale as we discussed, but the overall health. So there is no formal standardized nutrition guideline for the GLP-1 medications. Which means like the nutrition advice is individualized and it depends on what symptoms or what nutrient deficiencies you might have. So here are some simple eating strategies that can really help, especially if you're dealing with nausea, early fullness, or slower digestion, which are the most common side effects of the GLP-1 medications. So you can try smaller, more frequent or like meals or snacks instead of large meals. You can eat your largest meal at the time of the day when your appetite is the strongest. For some people, that can be in the morning, and for some other, that can be later at the day. You can also eat slowly, chew very well. This can ease the nausea and can help you feel more comfortable. You can choose softer, easier to digest foods if your stomach feels sensitive. After eating, you can try to stay upright for at least an hour, as the gravity can help with the digestion. And you can adjust your fat and fiber based on your symptoms. If things feel too heavy, reduce high fat foods temporarily. If fiber is causing bloating, lower it a bit and increase it slowly over time. And make sure you're getting enough protein every day to protect your muscle mass. You might need to use some oral nutrition supplement or protein powder, as we discussed before, to ensure you get enough protein and calories. You want to also stay well hydrated. You want to do something like sipping fluids throughout the day, as this can make it easier on your stomach than drinking large amounts at once. So exercise while on GLP-1, especially resistance exercise coupled with enough nutrition and protein, is very important to minimize muscle and bone loss and help build a routine of incorporating exercise in your lifestyle. So the research shows that participants who had lost around 17% of body weight then stopped the drug regained about 2/3 of the lost weight within only 1 year. And the net weight loss from baseline after 120 weeks was only around 5.6%. That is why building a healthy nutrition habits and incorporating exercise in your routine and maintaining these habits after stopping the medication can help you sustain the success you gained while on the medication. So if we look at the Canadian Adult Obesity Clinical Practice Guideline, we see that the recommendation for the nutrition therapy for weight management is to focus on improving healthy habits and quality of life rather than weight loss. Weight is not a behavior, and you should not target, and the weight should not be a target for behavior change. Also, how you eat is as important as what and how much you eat. So practicing eating mindfully and promoting a healthy relationship with food is very important as well. So if we look at mindful-based eating programs, they have been shown to reduce binge eating, emotional eating, They help in sustaining weight loss. They can improve A1C slightly by 0.3 or 0.5%, and they can improve post-meal blood sugar response as well. So mindful eating can work best when combined with structured nutrition counseling. I want to clear up some common misconception about mindful eating. So mindful eating is not a diet. It is not about rules, calories, or restricting what you are allowed to have. It doesn't label foods as good or bad. Instead, it's about helping you tune into your body so you can understand what you truly need, both physically and emotionally. So, what is mindful eating? It means bringing gentle, non judgmental awareness to your eating habits. We pause and ask ourselves small questions like, why am I eating right now? Is that a true physical hunger, or is it stress, boredom, routine? Am I eating? How does it taste? How does it feel in my body? Does it satisfy me? How am I eating? Am I rushing? Am I distracted? What's the environment like? So let's look at the different types of hunger. There is physical hunger, which builds gradually, and this is your body's true need for food and energy. There's also emotional hunger. It comes from feeling like stress, sadness, loneliness, boredom. It's more about comfort than nourishment. There is mouth or taste hunger. This happens when you crave something just because it smells or looks good, even if you're not physically hungry. Um, and practical hunger is when you eat because it's mealtime or because you won't have a chance to eat later, for example, before a meeting or an event. So being aware of the type of hunger, um, it can help you pause and decide what your body actually needs, whether that's food, water, rest, or maybe emotional support. Once we start recognizing what triggers our eating, we can begin to practice more mindful habits. So let's talk about few ways to do this. So some of these practical strategies, like pausing before eating. Take a moment to check in with yourself and ask, what kind of hunger am I feeling? Is it physical? Is it stress, habit, and so on? There is no right or wrong answer. This is simply about awareness. So next, check in halfway through the meal. A helpful tool is the fullness scale. So on a scale of 0 to 10, 0 is extremely hungry and 10 is painfully full. Most people feel best stopping around 7 or 8, so comfortably full but not so stuffed. Again, not a rule, just information to help you listen to your body. Slowing the pace can also make a big difference. You might try putting your fork down between bites, chewing a little longer, or taking small sips of water. Turning off screens or reducing distraction can help you taste and enjoy your food more. So mindful eating is especially helpful for what we call trigger foods. So instead of avoiding foods, something like sweets or chips altogether, you can plan small intentional portions and really enjoy them. This reduces that all or nothing feeling so many people experience. And finally, you can also reflect after the meal. Just gently notice, how does my body feel? how do I feel emotionally? This helps you learn what truly satisfies you and what doesn't without any judgment. So this concludes my presentation. Thank you so much for listening, and I hope you are leaving with some tools and confidence in improving your health and well-being. Thank you so much.